today we're today we're talking about the systemic introduction. Okay, it's not going to be just systemic therapy, but we'll take in our statements to acknowledge that today we are coming.
You're breaking up a little bit, Haley.
To territories. We acknowledge these homelands, recognize and respect Indigenous people as the original peoples of these lands. Please take a moment to reflect, acknowledge, and honor the original occupants of the land you live, work, and play on. So just an introduction. So first, if you haven't met me already from previous sessions, my name is Haley. I am one of the CST business learning leads. I just joined, I think today is my 7th week. So we're learning together, if that makes any sense. I am a nurse in background, and I've been in healthcare for over 18 years. And I've worked in Fraser Health, BC Ambulance as both a learning expert and violence prevention specialist as well. Helping me out today is Rena. You're in the room. You want to introduce yourself?
Yes, hi, I'm Rena Benamarito. I am a clinical informatics specialist here at BCC Prince George. I'm also a nurse by background. Most of the last 8 or so years I've spent in informatics, so I'm happy to be helping out here. Thank you.
And Anisha is in the background as well, helping out and doing the recordings. Anisha, you want to say hi?
Yeah, hi everyone. I'm Anisha. I'm a business analyst with BC Cancer. Yeah, just be here in the background.
So last week we were talking about CST Cerner help, and this week we're going to discuss systemic therapy appointments. Next week we're going into kind of the triage workflow, referral workflow, and then the week after that we'll talk about power chart and the M pages, various M pages. Keep in mind that all demos will be, we're going to record them and we're going to send out the recording for you to view in case someone's missed a session or you want to re-review it. We're trying to send them out at the end of each week. That way, if you missed the week before, you could view it before you join the next week. And we will have a question period at the end. So just please hold all your questions till the end. So part of our agenda is to go through power plans, booking in the patient, verifying demographics, printing the wristbands, closed loop medication administration, tracking tools, and documenting in iView. So we are trying to address all of the different disciplines as we talk about each item. It won't be focused on just providers or clerical staff or whatnot. Okay, so we'll start with power plans. So under the menu tab, I'm just going to open my laser pointer here. So under the menu tab, if you click orders and add an order or add, you can add your power plan. Okay, and this is the best way to go about it. This is the direction we want to take when you're adding your power plan. Okay. Then under, if you look in this gray section, it'll show you the different components of your power plan. So you'll see like there's labs, there's prescriptions, there's scheduling, okay? And then as you open, you can modify further. Okay. So this is like an electronic version of the requisition. So when you complete it, it will notify the correct department. So chemo would land with pharmacy, scheduling would land with the clerks, and so on and so on. The X here in the corner means that some information has not been entered and you're missing something. So you need to open that up and fill in the information that's missing. Okay, this is just the lab view. So if you open the lab tab, you can see all the different labs. You can check which ones you want, and you can modify as you needed. Another tool you might find useful is the chemo calendar. The chemo calendar is located off the oncology tab. Okay. The chemo calendar shows the patient's infusion appointments. And in the outpatient setting only, it is used by providers and oncology infusion nurses to push out the scheduled requests for future and rescheduled chemotherapy visits or cycles, sorry. Now we'll go into booking the request. So now the clerk has gotten the request. So once the provider signs the infusion chemotherapy visit order, in the power chart, an appointment request generates and autofills on the ONC System Therapy Future Requests list for the selected BCC site. Okay. From there, when the patient arrives, the clerk will verify the demographics during the check-in. So they'll review various information, their name, their address, phone number, and then they'll click complete when they're done. And when they do that, then the armband window opens up and you can click which things you need. Or if you don't want to print anything off, you would just click the do not print documents before you press OK. This slide just shows different areas that will need to create armbands. So whenever you're checking in these areas, you'll need an armband. So chemo, medical daycare, and CT contrast. And then whenever a medication is administered, so chemo, transfusions, hydration, and CT contrast. But with the transfusions, you also need the group and screen armband, which UHNBC will print off. Okay? And all the allergies are indicated on the armbands. Going into closed loop medication, so right client, right medication, right time. So to go through, this is just a generic view of medication. So first we perform the positive patient identifier with 2 approved identifiers. Then we open the medication wizard, the MAW. We scan the patient's ID band. We double check the medication against the listed medication. We verify by scanning the medication. And then when we've done that, so when the medication scan matches the other details and all fields have been marked, the line turns bold and then you can see a check mark appears. Okay. Then we go into our positive medication, preparing the medication next to the patient. We administer the medication, medication's accepted by the patient. We sign and document. Okay. So a medication is not activated until the nurse activates it. Okay, so the drug will not show up on the MAR until this is done. So look out for your little light bulb. To access the MAR, so you go in the menu view under MAR, and then you'd open up and you can see different views will appear. So right now we're chose the time view, but there's other views. There's therapeutic class view, the route view, plan view, and taper view. And then in the time view, you can see the medications and the date and time. So you'll continue administering the medication using the MAW. You're going to open the MAW. Okay, so the application is in Cerner. Okay, the armband will be scanned, and then you'll see this screen. Okay, then you'll verify the medication, and this screen will pop up. And then the status will be updated to complete once medications have been looked up on the MAR, verified medication is done, then the complete will show up. Okay. Some tracking tools you may use. So located in Power Chart, in context with your workflow, this is what your calendar appointments for the day would look like, and you can add a note. So here, if you click the little plus there, that opens up this window, and then you can add a note that others can see. Okay. You can also access your patient's chart from Ambulatory Organizer. Okay. Mostly used by the systemic therapy is the tracking shell. It will show resources. It's kind of like a virtual version of your giant whiteboard. So the tracking shell window can be opened from the main toolbar in Power Chart. So you're in Power Chart, you go into your tracking shell, okay? You click the tracking shell toolbar. The oncology tracking shell columns can display patient details and nurse-related activities, okay? So you can see all kinds of details here. This is like a bigger version And when you're in here, it's a communication tool between pharmacy and nursing as well. So similar to how the patients are tracked in case, it lets the nurses know that the medications are ready. And then documenting in iView. So to document in iView, you would go under the menu tab, interactive view and INO, and then you can go into the section that you needed. There's, I'm going to show in a video in a minute, all the different drop-down options. But this one's something you'll go in probably most frequently is vital signs. And then you can enter your height and weight and the various vital signs here by clicking on the box you want to enter information on. Okay. If you're documenting, you want to add a note. So you documentation, the plus sign, add a note. You're going to fill in the information, your position, the type of note you're adding, the title to your note, your date and time, right? And then you can add a note that others can see as well.
This is probably how you guys were done.
Yeah. And then ambulatory summary is another view you can see. And this shows kind of all the trends and how they look. The one thing I like about ambulatory summary, or a lot of the summary pages, is if you go up to the box here, if you see those 3 lines, you can change the color of your section there. And then the arrow next to it just collapses or expands the section that you want to look at. So say there's an area you don't really want to look at, you collapse it, or an area that's really your focus that you need to recognize and see quickly, you can color code it. This again is just, oh, sorry, this is the video. Hold on a second. So in here is just showing you how to get there, going into there. And I'm expanding, I'm going to expand a couple of the areas so you can see what's available for you. And I would just say make sure that you're documenting in the right section, because I know like vitals appears in different areas. Okay. Because you see vital signs here again, but it's only in reference to the blood and product administration. And then make sure you click the check mark when you're completed, or else it won't record it. Okay. And then this is a summary end page. It's the oncology flow sheet. So the flow sheet displays clinical results in the context of the patient's treatment. Information is not entered directly into the flow sheet, but pulls from other charting done in CST Cerner. So again, under the menu, oncology tab, and into the flow sheet. Okay. All done. What questions do you guys have?
I do want to mention, so I think you saw Kaylee pull up like a power plan. So one thing that you might hear as well is regimens. So regimens are kind of like a grouping of power plans to include like different phases, like how we have our PPOs that are kind of built into like different cycles depending on what was ordered for the patients. So our PPOs are kind of synonymous to what you will see in Cerner as power plants or regimens. So just be aware that you might hear both of those terminologies interchange.
I do have a question about orders. So sometimes the oncologist or the GPO will put in their order a referral to patient and family counseling. Will that be an option for them in like when they do the orders in Cerner?
Yeah, so there will definitely be referral orders to the different clinics. So what that order does is it sends it for triaging. Like if your department has been set up for those referrals to be triaged. So there's a workflow for that where, like, let's say maybe Carly, in your case, would see something come through and then communicate to you by messaging or some workflow that you have a referral that you need to triage. And then it's kind of like back and forth. Once you decide that, yes, I'm accepting this referral, then it then sends it out for scheduling the patient to come in.
Okay.
Yeah.
So, because sometimes either the patients are already known to us and they're like, people have been on treatment and treatment's not working, so people are upset, so then they'll get a referral to us for counseling support. So then if they're already known to us, could Carly automatically just assign to us if the person is known to us? Or does it have to go through the whole triage?
Well, I think if you already know that you're gonna see the patient, then she can, well, the recommendation is have it go through an order. So there would still need to be an order so that we can create the correct encounter of it. So I'm pretty sure you've heard of encounters multiple times, but yeah, so that's it kind of helps drive the encounter creation along the way. So it is recommended to have that order be put in place, but there are ways to kind of like jump ahead and just schedule the patient, straight away, but that is not the recommended pathway.
So what will happen is like, so there'll be Bob Smith, and I've known Bob Smith since September, but Bob hasn't needed anything, but he goes and he sees Dr. Collins, and Dr. Collins is like, I really want you to see Bob. Bob says he wants to see you. She will, right now, she either emails me or she sends a paper referral. Okay, so with Cerner, she would just add that to her order. And then it would go to Carly. And even though I've already seen this person, it would have to be another encounter to get assigned to me.
Yeah, we're going to get into that a little bit next week too, because we're going to talk about entering the referral order and kind of how those steps go.
Because it's like there's already a relationship, right? It's not a new referral that needs to be triaged, it's existing.
Right. I think it's just for record tracking as well.
Okay.
Right. So
Just understanding sort of how that happens, right? Because honestly, what happens now is people just email me, can you talk to so-and-so?
Yeah.
That happens all the time.
Right. Right.
And then I talk to so-and-so, and there's not that.
So that might be changing.
Which is fine, like I just need to know.
Just how it's gonna change.
Because then if that happens, which I suspect it still will, then what will be the process to when people email?
Right, it would be letting Carly know.
Yeah, which is
And then
fine.
having her
Yeah.
interviews, yeah,
Like,
yeah.
it's very doable.
Yeah, so I
you'll
guess
have boot camps. Oh, go ahead.
there's more of an electronic trail to it now versus just a phone call. That makes, people online can ask questions as well. Nope. They're being gentle.
I do want to call out the other piece that you showed, the ambulatory organizer, because I think that is what most people will start to get to know, because that's where you see, all your patients scheduled for the day to your resource or to your department. So I think that's really one thing that you might want to take away.
Yeah, it's going to be your primary page to work from for almost all designations. Like,
It's like your Outlook calendar for the day.
Yeah.
Right.
and that one has color codes and stuff like that. We showed it a little bit last week as well.
Yeah, and some areas have like hover to discover functionality. Like there might be an icon there that you might not know what it is, but when you like hover over it, kind of gives you a bubble that kind of describes what it is. So just like a little tip for finding out like what certain things do. But you'll get to know that.
I won't retain that 4 months from now.
Yeah.
I will tell you, as someone who's learning it for like as we go and stuff, it gets easier with time. Things are starting to become more and more familiar. I don't have the added challenge of knowing what case looked like before or having to work there, but I do have the challenge of knowing Meditech and having to kind of alter my thinking. So
You can go through that in your workbooks and boot camps and such. I know Kayla is your mentor, so she'll definitely share all that information with you.
There's tons of resources for training and support. Right. So Wednesday and Friday, we're going to redo this section. So if you can share notes, and if you think someone it would help them to be here, please share that with them so that they can come. And then, of course, after Friday, we'll send out the recording. Okay. And then next week, we'll move to a new topic, which is triage referrals.
For those online, Haley, have you asked them to share their info in the chat or?
Yeah.
Okay, great. Thank you.
So.
All right.
All right. Thank you. I'll give you guys your time back. And
So much.
Thank you.
thank you. Take care.